So how do you treat a sinus infection? Sinus infection is a term that I hear a lot, and a lot of times the problem is people are conflating, putting together the terms infection and inflammation. Infection and inflammation in your sinuses are really similar because the reaction to an infection is inflammation. The tissue gets swollen, the tissue gets leaky, so you get a lot more mucus. People will have a ton of mucus coming out of their nose. They've got some puffiness, some pain, sometimes a headache. They say, okay, I've got a sinus infection. A lot of times it's not the case. Your tissue can be inflamed, and it can be inflamed because you've got a viral infection, you've got allergies, something else, even a change in barometric pressure can cause that inflammation. So what do you do about inflammation? Well, if it's allergies, you treat with allergy medication, and some of those medications, the intranasal steroids especially, are usually where we go first. Now, they have to be used consistently and they don't work right away, but they relieve most causes of inflammation. If you are dealing with allergies, you can also use antihistamines. Though if you've got just something that's irritating your sinuses and it's not a real allergic reaction, those don't tend to work so well. If you've got a cold, then you can use over-the-counter cold and cough medication, and that can help to a small degree. And if you don't have high blood pressure, you can use things like Sudafed to kind of decongest your sinuses a little bit, and that can give you some relief. When do you need antibiotics? So when you have sinus pressure and pain, antibiotics are often going to not do very much, and the sinuses likely would have gotten better on their own even without them. Then all we've done is exposed you to potential side effects of the antibiotics. However, if you're 10 days into this and this has not changed at all, then we can make a case for antibiotics. If we're dealing with somebody who had these kind of symptoms, they start to feel better, and then all of a sudden they start feeling worse again, they get a fever, that's a sign that this has passed over into a bacterial infection and antibiotics can be useful. But if we're using antibiotics on allergies or a viral infection, they don't do squat. And all we're doing is complicating your life with possible side effects.